Rhinoplasty is more than a cosmetic adjustment. It is a precise structural surgery that reshapes bone and cartilage while preserving breathing function and long-term stability. At the beginning, we see the natural anatomy of the nose. In the preoperative profile, a dorsal hump projects along the nasal bridge. Internally, the septum is slightly deviated, narrowing one airway. The lower lateral cartilages create mild tip asymmetry. Airflow becomes turbulent as it passes through the internal nasal valve, the narrowest part of the nasal passage. The imbalance is both aesthetic and functional. Now compare this to healthy anatomy. In a structurally balanced nose, the septum sits at the midline, the nasal bones form a smooth dorsal contour, and the lower lateral cartilages provide symmetrical tip support. Air moves evenly through both nasal passages with laminar flow and minimal resistance. When deviation or dorsal overgrowth develops, the internal valve narrows. Even small structural changes can significantly affect airflow dynamics. Over time, patients may notice difficulty breathing, nasal congestion, or dissatisfaction with facial balance. High-resolution CT imaging confirms the septal deviation and the bony cartilaginous hump. Digital 3D planning allows surgeons to measure dorsal height, tip projection, and valve angles. Every millimeter matters. The surgical plan maps incision placement and structural adjustments while preserving essential support. On the day of surgery, the patient is positioned supine with the head stabilized. After sterile preparation and general anesthesia, an open rhinoplasty approach begins with a small transcolumellar incision. The soft tissue envelope is carefully elevated, revealing the underlying cartilaginous and bony framework in full anatomical continuity. The first structural step is dorsal hump reduction. Using a precision rasp, the surgeon gradually smooths the bony prominence. The cartilaginous component is conservatively trimmed. Reduction is incremental to maintain dorsal aesthetic lines and avoid overcorrection. Attention then shifts internally to the septum. The mucosal lining is gently elevated, exposing the deviated cartilage. Only the distorted portion is resected, preserving a stable L-shaped support strut. The remaining septum is repositioned to the midline, restoring symmetry and improving airflow potential. A portion of the harvested septal cartilage is sculpted into thin structural grafts. These spreader grafts will reinforce the middle vault. Precision shaping ensures smooth edges and balanced thickness. Next comes refinement of the nasal tip. The lower lateral cartilages are reshaped using strategic sutures rather than excessive removal. This preserves strength while improving definition and projection. Symmetry is checked repeatedly from multiple angles. Controlled osteotomies follow. Small, precise bone cuts along the nasal sidewalls allow the nasal bones to shift inward, narrowing the bridge and closing the open roof created after hump removal. The repositioning is subtle but transformative. Spreader grafts are placed between the septum and upper lateral cartilages. These grafts widen the internal nasal valve angle, stabilizing airflow and maintaining dorsal contour. Once alignment is confirmed, the soft tissue envelope is redraped smoothly over the refined framework. Layered closure restores the external skin with minimal tension. A protective splint supports the bones during early healing. In the days following surgery, swelling gradually subsides. Microvascular circulation reestablishes around cartilage grafts and osteotomy sites. The inflammatory phase transitions into regeneration. Oxygen and nutrients support stable integration of all structures. Over the next several months, bone remodeling occurs along the osteotomy lines. The initial callus strengthens and matures into smooth cortical continuity. Cartilage grafts integrate through fibrous stabilization. Collagen within the soft tissue envelope reorganizes, refining the final contour. Functionally, airflow becomes smoother and more symmetrical. The internal nasal valve remains open during inspiration, preventing collapse. Breathing feels balanced and effortless. Long-term, the nose appears harmonious with surrounding facial features. The dorsal line is smooth. The tip is defined yet natural. Internally, the septum remains aligned and structurally sound. When viewed side by side, the transformation becomes clear. The preoperative nose displayed a dorsal hump and septal deviation, narrowing airflow and altering facial proportion. The postoperative result shows a refined bridge, centered septum, stabilized valve, and preserved structural strength. Rhinoplasty, when performed with anatomical precision and respect for function, is a balance of science and artistry. It reshapes structure, restores airflow, and enhances harmony not by removing identity, but by refining underlying form with meticulous surgical control.